Thank you everyone for participating. I've seen an initial list of participants and I realize we have people from all over the world. So it must be very late or very early for some of you. So thank you very much for joining the World Health Organization today in this webinar. So the reason why we are here today giving this webinar is because we have joined forces with other agencies of the United Nations and also some NGOs and universities on creating this massive online course, this e-waste challenge that we invite you all to join. So this was launched earlier on in February, and I understand now we've made the health pillar accessible. So the reason why we're here together is because we have shared priorities. We all have this shared concern about this e-waste challenge, and we also have this unique opportunity right now to address it before it becomes too late. And as we will see today, it really affects human health. So as part of this massive online course, there's 5 main pillars. I will focus today mostly on the impacts of electronic waste on children's health, which is the pillar developed with WHO, the 3rd pillar. And we will look a little bit at occupational exposures, but we will focus mostly on why children need to be specially protected from electronic waste. So I hope you can all also join the MOOC and not just join the webinar today. So yes, so this is the 3rd pillar. In the MOOC webpage, you can also find a presentation by the director of our department, a video on why it is so important, why electronic waste is actually a health problem that we need to address today. So to begin with my webinar, I will introduce myself. I'm Marie-Noëlle Brune-Pries. I'm part of the Chemical Safety and Health team at WHO in the Department of Environment, Climate Change and Health. We have also developed some training materials, especially geared at the health sector that are online. You can find our website at the end of the webinar, and I'll be using some of those slides and other slides to give you a little bit of an overview of the health aspects of electronic waste and action that can be taken at health level. We have a very varied audience, so some of these concepts may be more familiar to some of you than others. And I won't be focusing so much on the necessary policies for electronic waste because that is covered by other webinars and other parts of the course, but I'll be making a strong argument on why it is important to protect health and why health should be the main promoter for these actions around electronic waste. So this is just, I'll go over this very quickly, but a couple of years ago, our estimates in WHO showed that 1 in 5 children under 5 years old 1 in 4, children under 5 years old in the world are dying because of preventable causes related to the environment. So be it air pollution, be it waste, be it inadequate access to water and sanitation. We also know that 25%, actually 26% of the diseases in children could be prevented if we lived in healthier environments. And this is only, again, the tip of the iceberg because this is what our estimates show us, but there's many things and many impacts and exposures we cannot estimate yet. So this is why it's so important that we have actions on the environment today. So as I said, these are many of the environmental factors affecting children, and we have more traditional factors like air pollution, climate change that has now become more of a traditional factor because we've known about it for many years. Hazardous chemicals, radiation, but we are becoming more and more worried about certain factors that we have not been addressing so far, and we have not identified as health problems until now. And one of these main risk factors that is really emerging as a health issue is electronic waste. So one of the reasons why we focus on children and children's health is because we recognize that children are not little adults. So even if workers are the ones handling e-waste in many times, we also know that children are often involved, especially in the informal sector, on recycling electronic waste. As I remember, the statistics say that about 80% of electronic waste is being handled informally and so is not being properly recycled. So these are the 4 main reasons why we'll see why we need to focus on children. First of all, because they have their different and unique exposures. Children, there's a lot of e-waste toxicants that cross the placenta. Heavy metals, we know that placenta today is no longer a barrier, so it can reach the developing child even before the mother knows she's pregnant. We also have a lot of these chemicals that can come to the child through the breastfeeding. Children also love to put their hands in their mouths, so they have these exploratory behaviors. So, for example, they're much more exposed to lead in dust, for example, than we are because they put the dust in their mouth, and also because their organisms are not always able to get rid of these contaminants because they're not completely developed. They live closer to the ground, so they breathe more dust and contaminants than we do, and they often do not understand danger. This is especially true of early life stages in children, but also of adolescents who often have this kind of, well, some of you may be very young, but this kind of James Dean behaviors where they think that, nothing will ever happen to them, even if they're exposed to danger. So for electronic waste, certain exposures are really important. They are related to the occupation of the parents. As we said before birth, the parental exposures can expose the children to neurotoxicants, the future children to neurotoxicants, and also to some injuries of the parents that can also have an impact on the children. Then during infancy, they are exposed through the parents' work. I mean, the parents often, if they don't wash, if they don't change their clothes when they go home, children can be exposed to these heavy metals and chemicals. Then during childhood, sometimes they work. Children have little hands, so they're very useful for dismantling electronic waste. Sometimes many of this electronic waste is also sometimes recycled at home, in home workshops. And then in adolescence, of course, many of children, especially male children, often work with electronic waste as they start their work life. So as I mentioned before, some of these contaminants can reach the children at a very early stages, for example, through breast milk, even though in WHO we still believe a child should be breastfed because breast milk has a lot of very good things for you, like it really strengthens your future immune system. We do know through surveys that it can be very contaminated as well, especially in the places where the heavy recycling, formal recycling is taking place. And we also know that it can even have effects before a child is born or before a child is conceived in the preconceptional phase, and this may even be transgenerational. For example, it may affect spermatogenesis in males, and also things like lead, for example, they get deposited in the mother's bones, and it stays there associated with the calcium. But then during pregnancy, the calcium in your body is circulated again in your system, in your body, and so with the calcium comes away the lead, and again, it can cross the placenta and reach the child. We mentioned the issue of child labor. Of course, this is something, there's conventions by the International Labour Organization, and child labor, especially hazardous child labor, should be banned. Any work that is jeopardizing children's health or mental capacities. There is also a basic minimum age for working that is about 15 years of age, and also the things that you work with should not be, as we said, compromising your health. And when you work as an adolescent, you should be doing lighter kind of chores and not necessarily doing something that is that can expose you to injuries and even less toxic materials. So this is just to show you, I won't dwell much time on this, but this is just to show you that the red bars you see here are the really critical windows of development when our different systems are developing, and so especially any toxic exposures during those times and heavy metals, for example, we're exposed to, can have a heavy effect on the development of those organs, even though we know that something like the central nervous systems and the brain development continues until past adolescence, until about 20 years of age. We have about the same length for our respiratory system, so all throughout our life, the impacts we have during our development are very important, but they're especially important in early life. So, and this is the two last reasons why we really focus on children, and we believe children are not little adults, like we used to believe in the past, is because they have a longer life expectancy. So many of these toxicants, for example, if some of the components on e-waste are cancerogenic, and so cancer may develop much later in life, and a child has many more years to live in front of them. So these exposures, again, can have an impact on the child's future health, future productivity. We also believe especially for younger children, we are the ones creating the world for them, and we need to protect them. They don't have a political voice, though lately, especially in the context of climate change, we have heard them on the street, and we do know that they have a very strong voice, but often the decisions are ours. And another thing that is really coming up with a lot of strength right now are children's rights to a healthier environment. There's even probably going to be the first resolution on children's rights to a healthy environment soon in the United Nations Office of Human Rights. And there's a lot of reports. There's one also that focuses quite heavily on electronic waste from the human rights rapporteurs that focus on children's rights to healthier environments, and the issue of electronic waste is coming up very strongly there. So we do have an advocate in these groups for giving us power at the field level to actually promote actions. So now that we focused on children's special vulnerability, we'll be looking at how they are exposed through the informal recycling and the informal treatment of electronic waste. And so many of you know this. I mean, the primitive recycling of electronic waste involves open burning, recycling and recovering. It often ends up in landfills. And you have to remember that waste sites are children's favorite playgrounds. They love to play there. If there's things they can injure themselves, they will probably injure themselves. They are little explorers, as we saw earlier on. So we have identified over 1,000 chemicals in e-waste streams. Not all of these are toxic. Some of them are actually valuable, but many of them do have major health concerns. So these include heavy metals, polycyclic aromatic hydrocarbons that are released mostly from the burning of electronic waste and can be cancerogenic, polychlorinated biphenyls used in electrical equipment, brominated flame retardants used to keep the equipment from setting on fire, polybrominated diphenyl ethers, and a lot of plastic components, especially when they are burned, they release dioxins, which are highly cancerogenic into the air. Many of these are also persistent organic pollutants, which means that many of these chemicals will stay in our environment for a long time, even after the e-waste has been dismantled or recycled. So I'm not going to spend a lot of time on this slide, but it's just to show you once again the amount of different hazardous chemicals and metals we can find in the different e-waste components. So as I said, there's different ways in which children are exposed to electronic waste. So sometimes it's because they work with the electronic waste themselves. And so in that case, we can have injuries, we can have corrosive agents, we can have high levels of toxicants where they work, of lead, of mercury. Sometimes those facilities or the places where this recycling is done is poorly ventilated, which means a lot of the polluted air and dust, they remain within inside. Also through home-based practices, there's a lot of this e-waste that is being recycled within the homes. I visited an e-waste site in Mexico where actually a lot of the children's rooms in the homes were separated by piles of discarded batteries, for example, and in many of these homes as well, the small gardens, when there's any gardens, become a real junkyard of electronic waste components. And you can really find a lot of pollutants, especially if you measure lead. You can find very high lead levels inside those homes. And then when electronic waste is being recycled somewhere, these toxics again remain in the surrounding areas. So even though the family or the children or the parents are not directly working on electronic waste recycling, there's a lot of these contaminants that stay there and reach the air and the food. So yes, and there's also many of it is being thrown into landfills. As we know, we have sometimes some places in the world where there's a specific town that deals mostly with electronic waste, like it is the case of Ababgloshi in Ghana, but there's always many other places in the world where there's not even a recognition that we have an electronic waste problem, because electronic waste is part of the waste landfill, of the waste recycling that goes on, and it's just one of the streams. So again, the children can get exposed via inhalation of indoor and outdoor fumes and air pollution, also through the contaminated dust and soil. As we saw, some of these chemicals are persistent, so they can stay there for a long time. They can contaminate the water, and they can contaminate the food. I think there was a study on on eggs in Ghana that showed that just one single egg in Abogloshi could have a way higher threshold of dioxins that you would have in an egg anywhere than would be allowed by WHO and than eggs should normally have. We also have to see that a lot of these contaminants love to bind to fat materials, which means animals get these materials in the fat and in their milk, and these toxics, and so it reaches the children again and again. So again, why we worry about electronic waste and child health in WHO is because this is not only an environmental problem, but it is a human health problem when improperly managed. And a few years ago, we got this statistic from our WHO collaborating center in Uruguay, and in Montevideo, they have very traditional lead problems. They have some areas have high elevated levels of lead, especially because of ore recycling plants. But right now, they're seeing that 25%, 24% of the children that come to the environmental pediatric unit that have high blood levels, it is related to the burning of cables that is happening all over the town, and they leave black stains. In order to retrieve the copper, you also have lead in these cables, and so there's a new very high fashion of lead exposure right now that is related to electronic waste, and this was not seen before. So a few years ago, when we started working on electronic waste in WHO, we started doing, as you know, in WHO, we're very evidence-based. So we started doing a systematic review with our collaborating centers. And these are some of the things that we found in our review that were affecting, that were health effects related to improper electronic waste recycling. So again, problems with thyroid function, with lung function, with adverse birth outcomes. We were seeing children with decreased height and weight, behavioral attentions, and DNA damage, which may have an impact for the future generations. And there's even more health effects that we know of today. This review was done a few years ago, and will be, yes, and so anyway, we'll be publishing soon a WHO document in a couple of months, looking at all the different health effects in children connected to electronic waste. So the list is even longer than this one. And one of the things that really worry us is that a lot of these components in electronic waste are actually neurotoxicants. So they are affecting many different systems in the child's body, but they're particularly affecting their brains. We know that lead and mercury are very powerful neurotoxicants, and they can decrease by several IQ levels your IQ, your intellectual coefficient, and we know that this will have an impact on the productivity of a child. So at the same time as we strive so much for children to be able to attend school, to go to school, we really need to protect their brains from the beginning first, so that these brains can reach their full potential and not already be stunted, sometimes even before they were born. So as we see, these are some of the toxic effects that we've seen in the literature as well on children: neurodevelopmental deficits, damage to the blood and cardiovascular systems. This may be seen much later in life, not necessarily in childhood. Respiratory diseases, skin problems, gastric diseases, and we also know that e-waste workers suffer higher incidences of birth defects in their children and also higher infant mortality. So what we know so far in relation to health and health effects in children is that we have a lot of evidence on the different ways of contamination, of exposure. We know about the toxic effects of these chemicals. Many of these chemicals, we've known them for many years, like lead, mercury. We even have conventions around those because we know they're so highly toxic. We know the children are especially vulnerable, even though they are part of the communities affected by electronic waste. Along with their parents, we know there's an issue of social vulnerability here because many times these families, these communities, this is the only way they can have an income. So it's not easy to just take the children away from the exposure without the parents being able to find an alternative way of income. We also know that physical health outcomes, that means injuries, are very important when dealing with electronic waste informal recycling. But we also know that these children are being exposed to a mixture of chemical exposures, what we call the cocktail effect. So it's not just what lead does to you, but what mercury does to you, but it's a combination of all of this, and acting together, they can have a higher effect on your future health and on your health than just one single chemical. So again, the effects depend on the toxicity of the different chemicals, on the kind of electronic waste you're recycling, on the dose you're exposed to, but also very importantly on the time of your life that you're exposed to. Some of these effects may be visible only later in life, and in some cases may be intergenerational, like in lead, for example. We pass on the lead to the future child that will keep passing it on, probably during pregnancy if it's a girl, and also they can have long-term consequences on our health and disabilities. However, after I've scared you, I think this is a very unique time, and I think this is why I'm so thrilled that we have this massive online course and we get to talk about this today. And a few years ago, when we were living on the Millennium Development Goals, we didn't really have much of a place for something like electronic waste. But ever since countries have adopted commitments to reach now the Sustainable Development Goals, there is a very important place for prevention of toxic exposures and electronic waste. And I think the call from Sustainable Development Goals is for all of us to be working together. And there is, for those who are not familiar with the goals, there is Goal 3 that looks at achieving healthy lives and curing diseases. And then there's many other Sustainable Development Goals. The one on the number 12 one, for example, it deals mostly with chemicals and wastes. And I think it is through achieving all those other goals, all the goals where we have to work with the different sectors and involve the different sectors, that we will be actually achieving goal number 3 on having healthier lives. So I think this is a unique opportunity we have right now. And again, we all need to work together. I think health has a very strong role in electronic waste, but we cannot bring the solutions just on our own. And this is why we really need to work with the different agencies, the different sectors, the different communities. And so again, we need to take action at global, local, national, and local level in order to be able to achieve a difference. As for the WHO, we have World Health Assembly resolutions that countries commit to every year, and we have many environmental resolutions in the past 10 years that have been passed on our pollution, climate change, and we have one right now on the role of health in chemical and waste management, really with a strong roadmap for health to be able to promote the right policies and to build its capacities to address proper sound chemical and waste management. So again, there's a unique opportunity for health as well to make a difference today. Ever since 2013, we have a WHO initiative on electronic waste and child health. And we are looking at, again, increasing the evidence in the knowledge base on the health effects of electronic waste, at raising awareness and communicating on the health impacts, particularly in children. I think this is really important because when you talk about children, people listen. Sometimes if you talk about, what they do as a living, they may care less. But if you talk about the health of their children and the future generations, there is a stronger ear. And again, we have this mission also to build the capacity of the health sector to be able to promote actions to protect children from e-waste exposures, to work on the monitoring of exposures to e-waste. And this is really crucial, to work with the other sectors to actually implement the policies, to be it from not allowing electronic waste to come into your country, or also working with other sectors on coming up with better recycling options, how to formalize the informal sector with the workers. There's a whole range of different policies. And again, we need to also keep advancing the research on the health impacts on e-waste. We know quite a lot about the health impacts, but we also, I think there's also a very important kind of research that needs to be further developed, that is about what actions work and how can we in health help quantify how these actions work by reducing the health problems. So at the community level, and I'm going here mostly, a lot of the of the informal e-waste recyclers work in communities. Sometimes they don't have healthcare access. Sometimes they have, and often the people that are mostly close to in the health sector are the primary healthcare workers, and that is different from country to country. But again, I think primary healthcare workers, health workers, they're very respected members of society and also of the communities, and so they are listened to. And so that this is some of the things that we believe it is really important that they do. It promotes interventions to prevent, reduce, and mitigate exposure, guide surveillance, and especially for some of these diseases related for e-waste, work closely with the communities because the solutions can only come through within, by working with the communities themselves. Clearly identify the problem of electronic waste. Where is it? Where is it going on? Report it back to the mayors, report it back to the authorities, discuss with the different communities themselves, define what is the local characteristic, how it is happening, how you can address it. Again, being able to diagnose exposure and health effects. If you suspect, when you see a child that is having problems at school, for example, ask certain questions and think about the parent's occupation, for example, or what is being done at home. Educate other healthcare professionals. Many health professionals don't have any training on environmental health, and even least of all on electronic waste. So it's really important that we build the capacity of these health professionals so they're more aware of how exposures affect our health, but also what are the different ways to diagnose these exposures and also to be able to prevent them. Again, as we said, promote policies for the safe management of electronic waste, and very importantly, and this may be done maybe at a higher level than just the primary healthcare worker, is push for the chemical conventions to be not only signed but also implemented within your own country, the chemical and waste conventions. So these are just a few examples. In the MOOC, in the massive online course, you have a much more detailed section on the actions and on the different chemicals. But these are just some ideas of what we can do, of what healthcare providers can do. They can help monitor the exposures, for example, take samples, occupational, environmental, in some cases biological. Some of these indicators, some of these environmental biomonitoring especially sometimes is a little bit expensive, but something like lead usually can very easily be measured and it's not so expensive. So these are just a few examples of the different indicators that you can use to actually follow up if the policies and the actions are really having an impact. And we saw this with the town in China that was recycling electronic waste, Guizhou, and they followed up with measures, with lead measures, both before they started intervening and after they started intervening, and they really saw the lead going down after the interventions. This can also be done at the occupational level, in the measuring workplace air and dust. We could go more into detail here, but this is just an example. And again, healthcare providers, if you're working in a clinic, a primary healthcare clinic, just ask a couple of questions. And these are just a few examples of questions that you can ask. And so you can identify this problem and then maybe start a dialogue with the parents, or maybe become concerned about electronic waste, pinpoint where it's being done, and also talk to the communities and the different authorities, especially primary healthcare workers. They do spend a lot of time going through the different houses and advising the mothers on breastfeeding. They talk to the mayors, they talk to the schools. So they're really important in helping us solve this issue together. So these are just some examples of questions that can be asked. And again, we do have, as part of our initiative, we have developing some tools on capacity building. We have a training package and everything a doctor, a nurse should know about electronic waste and child health. We are also very pleased to have this massive online course now because, again, it brings a lot of complementarity between the different agencies, and we are just part of the solution. This is all bringing the different pieces of the puzzle together. We also have technical information on electronic waste. We have our systematic review, journal articles. We have a chapter on an atlas on children's environmental health that is dedicated to electronic waste. We will also have this WHO book, the first ever WHO book on child health and electronic waste, looking at health impacts and solutions for the health sector coming out in 2 months. And we also have, for the first time, when the next global e-waste monitor comes out, we will also have a dedicated child health chapter. We also try to disseminate this information as much as we can through our website and newsletters. And we do believe that in many cases, health is yet not aware that they have a health problem related to electronic waste. So we do have a lot of legwork to do still to bring awareness to this and to avoid that, our children won't be marching in 2 or 3 years for electronic waste like they're doing now for climate change. So as next steps of the WHO, of WHO's current work, we are, as I said, we're working on communications and advocacy, and we are building now a global e-waste coalition. We're 10 UN agencies working together on this, bringing what we all know about this to try to solve the problem together, build the capacities, the evidence, but also bring our first country pilots, joint country pilots, where we're not just going with our own little pilot or suggestion or intervention, but we're all going together. And so as part of this, we're starting some work in the Americas soon and hopefully in Africa as well. And so, this one doesn't look too good on the screen, but this is the WHO website for more information and to find the tools that I mentioned, and also, again, the website of the massive online course that I invite you all to join. It's free, and to also ask others, spread the word around so others can profit from it. And yes, and again, we are doing all of this for our children. So thank you so much for taking this time to come to this webinar, and I look forward to the discussions now.
Hello?
Hi, can you hear me okay? Colleague from BRS?
Ahead.
Okay, can you hear me?
Yes, please go ahead.
Yeah, this is Desiree here at the Chemicals and Health Branch. And thank you so much, Marie-Noelle. I'm so glad that you were available to give this presentation. Thanks for your excellent presentation. As you know, I'm working on lead here at UNEP, and this is really very inspiring to see WHO CEH really moving forward. And I think my question would be in terms of the health systems. I assume, for example, at the smallest rural health unit, what is the situation? Is the are our rural health centers prepared to deal with e-waste in general? You did outline several chemicals there, and I suspect our remote villages are still not aware. So what could we do in order to really engage our communities in the smallest level of the health system? Thanks.
Thank you so much, Desiree, and it's a pleasure to have you here in the webinar. I know you work in UNEP and you do an amazing work on lead in paint and other kinds of lead exposure. Yes, this is, health access is definitely an issue in many places of the world. As you know, in Africa, we have about 1/4 to 1/3 of healthcare facilities that don't have running water or don't have electricity. We sometimes lack personnel in many places as well. But that is, again, what I think the solution for the community level lies with primary healthcare workers, because they are the ones visiting the community and they are the ones who can talk to the people. And I think, again, the solution should really be locally oriented. And I think I also think electronic waste is a very good very good way to get into a community and not just work on the electronic waste problem, but also on other major environmental problems that they may have, because they probably cook with unclean fuels and they do many other things. So I think this is a way to raise an issue that can actually help us address others. But for example, in Montevideo, they are doing a lot of work for primary healthcare workers, especially in very economically deprived areas where there's very few health workers, and it's also very difficult to get in because there's poverty, there's often crime, but at the same time, they just these workers go around. They go to the different houses because they need to give advice on breastfeeding and for the newborn, and that's the time when they start identifying if there's electronic waste recycling, and they ask a few questions, and they also ask a few questions in the local clinic where the local people go when they have a health problem, and between the different questions, they can map out where the electronic waste is being recycled. And then they take advantage when they do, like every 2 months or something, these community gatherings between the school, the local authorities, the local champions or local leaders. They bring this up and they bring this problem, and they try to find solutions about waste, for example, in which they could maybe recycle the waste slightly different in a different manner, or do locally based workshop instead of each one doing it all over the town or in their own homes. So I think this is a matter of communication, and it has to be locally tailored. And one of the things that we really promote, of course, is that everyone should have access to healthcare. But beyond that, I think I'm not sure this happens so much in rural areas, because I think electronic waste is mostly being recycled in urban areas. But yes, but definitely, I think being aware and building the capacity of the people who are close to the communities is really the key answer from a health point of view.
Yeah, thanks, Marie.
Thank you.
Really, when we talk about the health sector, as the key people to do advocacy and community education, and also really the surveillance. I think it's very crucial and imperative for the health sector to play this role. And as you said, the health sector is very much respected in the community, and there's always this, people always look at the compelling evidence of the health impact. But I think we from the environment sector can do a lot also in terms of prevention, in terms of mitigation. Um, this proper in the BRS, in the Basel Convention, of course, we also work on the proper, we say, environmentally sound management, so proper recycling of e-waste. At the same time, we also want to reduce in the first place. So, and nowadays we talk about circular economy. We talk about design by design. So, yeah, so I think both health and environment sectors need to work together. Thank you.
Yes, completely agree.
Okay. Please, my name is Amma, and I'm connecting from Ghana. So I hope everyone can hear me. So I am working on an exposure assessment in children in one of the communities in Ghana. And in my work, I had to map out certain areas using soil to find out levels of heavy metals, to find areas where we have high levels of these heavy metals, and then I concentrate my study in those areas. So that is what I started doing. And then somewhere along the line, that was when I discovered that electronic waste recycling is actually going on in the community that I am working in. Initially, electronic waste was not part of my study, but I realized that it is actually going on a small scale from what I have discovered so far. So the problem is that in Ghana, we have a very big place. I think Marie mentioned it in her presentation, Agbogloshi, where now a lot of concentration, a lot of work is being done there. But what has not been taken into consideration are these small areas that have not come to the attention of the international platform, that there are very small communities that are also engaging in electronic waste. My study scope did not reach that part, but I found out and I became interested in electronic waste as a result of what I am experiencing right now. I am dealing with children that have parents or relatives that are involved in these small waste, electronic waste recycling in small capacities. So my question is, how is the WHO also working towards electronic waste being done on really small scales in these communities? Because I didn't know that it is going on in Tema, where my study site is, until I started doing my work in this area. So I would like to know what the WHO is also doing to target where electronic waste recycling is being done on small scale.
Thank you very much. And yes, I think in Ghana there's a lot of attention being brought to Abogloshi because you have a very, not unique, but you have a very heavy scenario there. But yes, of course, that doesn't mean that electronic waste is not being recycled elsewhere. And I think there's few countries like Ghana that have such a very big kind of e-waste recycling town, but most of the countries in the world don't know they have an e-waste problem, but the e-waste recycling is being done more at the scale that you mentioned in homes, in smaller communities. And again, I think for the health sector, it is why it's so important to be able to identify where this is going on and working with the other sectors to bring solutions to it. But I do believe that, I agree with you, this is going on in a small scale all over the world. So that's why I think one of the first thing is to become aware and also to be able to map out where this is going on. So for our first pilots that we're doing now in 2 countries in the Americas, this is our first step, is going to be building the capacity of the health sector, raising awareness, but also working with them on understanding in towns where exactly this is happening. And so that's when you work and you communicate with the different communities. But yes, I think it's an amazing work you're doing, and I'm really happy that this has led you to electronic waste. And I do hope we are looking now as part of the global coalition into bringing some pilots into Africa. And we know there's a lot of work going on in Ghana already, so we also hope to be able to work with you to learn from what you know so far, but also, I'm sure your e-waste problems are not limited to Abogloshi.
Thank you very much, Mr. Darcy, for your assistance. Thank you also to Marie-Brune for the presenter. I would like, if you can come back again about the way to go back to forward of WHO concerning the partnership with MOOC, precisely the slide before the last one. This is slide 33. Was so fast.
This one?
This one.
Yes. Okay, yes. So what I meant with this slide was that we are working, yes, maybe I went a little bit fast over it. I was conscious of the time for the discussion. So anyway, we are working now at global level. Our main goal is to raise awareness about this. We're hoping also to soon bring this issue to the attention of ministers at one of the World Health Assemblies. I don't know if we'll manage to do it in this one because of, the coronavirus situation, but potentially to the other one, because we would like every Minister of Health to understand that they probably have an electronic waste problem in the country, and this is a health problem to them. So again, this is why we're working so hard on communications and coming up again with guidance from WHO on why this is a problem and what are the different solutions for health. and at the same time, we are working with this global coalition that is being shaped into all the different agencies working together again on providing evidence, providing tools like this MOOC, for example, to be able to increase the capacities. But again, both the WHO both the WHO initiative and this global coalition initiative, one of our main goals is to be able to come to the countries, because we don't want to just work at global level on this, but to be able to bring the first health country interventions, the country intervention, sorry, for WHO, it would be the health component. For International Labour Organization, more maybe the part on how to formalize the informal sector. For Basel Convention, for example, on how to prevent electronic waste being imported illegally into a country, or how to set those laws in place. For other agencies on how to maybe to improve the recycling facilities. So our component, our health pilots that we're starting in the Americas soon, and we are hoping to bring to Africa later on in this year, focus mostly on what we've been discussing before. It's about building the capacity of the health sector, informing the health sector and the different health agencies, being able to map together the places where this is being recycled, being able to identify which are the local indicators that can be used, or the local monitoring that can be put into place to better evaluate the different interventions on electronic waste, and mostly working with the communities. And this is really to be tailored at local level to see how to involve them in the solutions for the electronic waste problem, mostly in how to decrease the exposure and to avoid this being recycled anyhow, anywhere, in ways that affect human health. So seeing about what are more feasible, what are the different roles that everyone can have, what can be done by the informal recycler that doesn't harm their health. For example, the cutting of cables is being tested in some places, or are the ones to, for example, bring back the different components to the ultimate recycling facilities. What are the ways in which they can keep the livelihood, but at the same time not use acid baths, not do massive burning of cables, not bring the children, protect, wash once they come home. What are the different measures that they can take to start reducing their exposures?
Thank you very much.
Thank you. Yes, thank you. So the second question, that was an IPEN study, and it was done in Amogloshi, of course. And I think if you want, Dan, I can send you the reference afterwards. I don't know if it can be shared afterwards. If not, it will be highlighted anyway in our WHO document. It came out about a year ago. Yes, that study. And then, sorry, yes, and so as matters of standards, I think you'll find in this MOOC that there's many other standards. For example, from the Telecommunications Union, there's also policies to be implemented by Basel Convention. So I don't know if those were the standards that the question was about, but I think, again, this is mostly the health aspect of what we can do from health, but one of the things we need to do from health is to make sure that all the other standards are put into place so that they actually end up protecting health. And so again, being able to advocate for healthier populations by bringing in all these policies that all the different agencies and all the different actors are promoting. So I think those were the standards, but I wasn't too sure.
There is a makerspace working on the development of tools for e-waste recycling, avoiding burning cables. We are a group of collaborating with them, bringing ideas and founding actions. And you should check the Recy Hub. I'm sorry, I think this is a response to a question that was sent via chat earlier. So you have the link on the chat box.
Yes, we are aware there are important a group of African universities and North American universities, and they're working on some of the health aspects as well, including some of the health aspects. And I do know also of work going on in Ghana, I think with, I don't know all the actors, but certainly Pure Earth, for example, on trying to see how to cut the cables to avoid burning them. I know initially this was a challenge for smaller cables, for thinner cables, but it was quite doable on bigger cables. And it also needed quite a bit of community dialogue because, it's much faster to burn 100 cables than to cut them. But at the same time, I think, again, this is where health becomes a strong argument. So yes, I'm very aware of, I know there's emerging work. Thankfully, there's work that's starting in Ghana, and that is great, in Amogloshi. is shaping up. We are now finalizing the final legal details and everything, but it should be announced quite shortly. Basel Convention is also part of the coalition, so you can be in touch with WHO, with Basel Convention, with any of the major ITU, any of the major agencies working on electronic waste, and when the time comes for being able to collaborate with the coalition, we'll certainly let you know, but we're hoping this will be sorted out very, very soon and announced publicly very soon. But yes, you can be in contact with me or, with Basel Convention colleagues, and we'll let you know when it's, when this part of the coalition that is open to other entities will be open. But I'm happy, Dan, I'm happy to, if you have any questions from WHO, you're free to email me. And if you want more slides on electronic waste and health and child health, you can always go to our website. That I mentioned at the end, there's a place where you can ask for the PowerPoints with the full notes and references, and we can give them to you. But I think it is also worthwhile taking this again, this massive online course, because it gives a very comprehensive view into electronic waste, and not just the health component itself, but all the different solutions and aspects to it.